Hello, thank you for joining us. My name is Yaminah and I'm a health educator with Argus Catch program. Today's session, we're going to be talking about tobacco cessation counseling and resources. Next slide. So tobacco cessation. This PowerPoint session will inform the audience of the counseling methods associated with tobacco cessation, along with behavioral aspects needed to change smoking outcomes. Next slide. Our intro. We're going to be talking about smoking cessation counseling, how it can help you quit smoking, counseling to prevent tobacco use and tobacco-caused diseases, and health education. Health education is a counseling approach that is used semi-structured scripts to provide information on the addictive properties of nicotine. As we talked in previous slides and previous sessions, that this is a educational tobacco cessation resource information approach to giving you the tools needed to quit smoking. So how many times can you try to stop smoking? It doesn't matter. It's up to you. It's you as an individual. Individuals can try to stop smoking up to 10 times until the person themselves has accomplished to quit smoking completely. It's up to the individual. Next slide. As many times as it takes, you determine your outcome. Next slide. So what is smoking cessation? Smoking cessation is the process of discontinuing tobacco smoking. Tobacco smoke contains nicotine, which is addictive and can cause dependence. Nicotine withdrawal often makes the process of quitting difficult. Throughout these slides, there's going to be little tips, introductions on the right-hand side. I'm going to also be reading those. Those are some informative decisions, tools that you can use. So this tip, speaking to someone can help you transition to quit. Many tobacco cessation counselors have resources they can provide. Next slide. So within the steps of tobacco cessation and going through the methods to quit smoking is a behavioral aspect. And a behavioral aspect are stages of change. By the end of this selection, you'll be able to visualize what stage you currently see yourself identifying with. Why do you see yourself at this stage? And when do you see yourself making a quit plan? Next slide. The stages of change model. Here is a model description of the stages of change. Pre-contemplation. So pre-contemplation is where a patient has not thought about or has rejected change. Contemplation. Contemplation is a stage where the patient is thinking and talking about change. So this is where a patient or a person that hasn't been to counseling is trying to seek out help, trying to seek out ways and support to try to find methods to quit smoking. Planning. Planning is when the patient plans what it would take to make change happen. So this will be the part where the individual is in the process, right before taking the action. So in the process of right before taking the action and allowing themselves to make decisions on whether they're going to take the next step. Action. Action is where the patient takes positive steps, putting a plan into practice. So by this time, the individual has made a plan and has started to execute the plan. Say an individual has made a list of potential counseling sites that they are interested in. And action is when they start calling or getting help to call to make appointments to start the process. Maintenance. Maintenance is where a patient achieves positive and concrete development with continuing support. So at this stage, the individual has been already in the process of tobacco cessation, has been through some methods, have been to a couple of counseling sessions where they are doing their best to maintain or reduce the use of smoking. Relapse. Relapse is when a patient falls back into old patterns, actions, and behaviors. Now, this is okay. Relapse is okay. Relapse happens. It's a part of the process. People can relapse many times, but you can still get back on the horse and you can still get back into counseling. You can still continue the cycle again and see what other different outcomes work for you. So you can try different methods. And within maintenance, individuals can keep, and we're going to be talking about this a little later, can keep a log, a diary in regards to their quit attempt. We're going to get into that more in a few. So relapse, it's okay. It's okay to have smoked a cigarette or to have instead of doing the routine that you adjust yourself to, maybe smoking 2 or 3 cigarettes and you fall back and you end up having maybe half a pack of cigarettes a day. It's okay. You can start the process over. You can tomorrow, the next day, you can make a plan to reduce again and start off by smoking 6 and then 4 and then 2. That's the process. And then you start over again. And you don't start the whole stages of change, but you go back to the planning. You go back to the planning if that is something that you choose to do. If wanting to stop smoking is something that that is something that you need to do. Next slide. Okay, so here goes some descriptions and suggested interventions. So stages of change again: pre-contemplation, no quit plan in the next 6 months, unimpressed, individuals who are not seeking to quit smoking at the moment, that they have no interest. And the suggested intervention is to assess the benefits and risk and availability of resource counseling. Contemplation. So contemplation again is when an individual starts to think about a quit plan. So a quit plan in the next 6 months, seriously considering to quit smoking. The suggested interventions are the pros and cons and motivational interviewing. So individual is assessing their benefits and risk, outweighing the pros and cons, and motivational interviewing is assisted in trying to get the individual to see the outcome, to see their best interests, what their best interests are. Preparation. So preparation is when a quit plan in the next month is in the foreseeable future. So an individual has been prepped themselves and has made a scheduled date. This doesn't need to be within the next month necessarily, depending on how long you choose to do counseling. But it's always good to make a set date. You don't necessarily have to meet that date, but it's always good to set a date. So you can start the behavioral change process. And the suggested intervention is why. And we give tobacco cessation counseling. Our counselors are given a tool to measure the individual's quit aspect and see what level they are in behavioral change. Suggested medication is also talked about at this process in regards to NRTs, nicotine medication, patches, gum, things of that nature. That's the medication is introduced at this stage, and we're going to be talking about that later also. Okay. The next one is action. Action is the attempt to quit. That you're going to make the step in the process of quitting. So some people have the ability to go cold turkey, and some people do not. So this action can be, again, reducing the amount of cigarettes you smoked prior to this step. So again, if you smoked a pack a day, you went down to a half a pack. If you smoked half a pack a day, you went down to half of the half a pack in regards to smoking. So if you smoke 10 cigarettes a day, you used to smoke 10 cigarettes, your attempt will be to try to smoke 5 cigarettes a day. So it doesn't take a day for some individuals. For others, they can quit cold turkey, but it's the length of the process, and the process can take anywhere from 1 day to 6 months to be tobacco free. Some people quit dairy, they start medication, they have withdrawal management, and we're going to talk about withdrawal management a little later also. You have provider support, your counselors, your family and friends and things of that nature. And then maintenance. Maintenance is the process of when an individual has stopped smoking and is doing everything in their power to not reach for that next cigarette. When they are having an urge, when there are stress or things are going on and they just want to go for that cigarette, that they don't. But it's okay. It's okay to relapse. It's okay to have that urge. We just have to find, as individuals ourselves, we have to work on ways to minimize the urge or minimize the reaction to the urge. Next slide. Okay, so we're going to talk about how to start behavioral change. In most tobacco cessation counseling, this is the approach. The barriers that smokers face when trying to quit, identifying triggers that cause smokers to relapse, continued support to and for smokers after they have quit. is to always ask questions. Always ask questions. When you're in counseling, it's good to always ask questions. Next slide. The 5 A's of behavioral change. Now, this is a method that counselors use to help individuals, and I'm going to interpret it in a way that you yourself can understand the steps of the 5 A's of behavioral change. So it's ask, assist, advise, agree, assess, ask, assess, advise, agree, and assist. So the counselor will ask you questions. They will assess the situation. They can advise you and agree with whichever method you would like to take, or with whichever step that you're willing to take, and assist you in those goals. Next slide. The 5 A's: assess, advise, agree, assist, arrange. Now, this diagram was in regards to diabetes. It was in the Handbook of Primary Care Psychology in 2004. So we're gonna use these steps. They're very similar. They're very similar. Most of the topics that we talk about and the methods that we talk about are used in a variety of different health issues. And diabetes is also a health issue that individuals need to manage and need to do a behavioral change in order to eat differently and have a healthy lifestyle that they might not be accustomed to. So it takes a lot of work, and it's just like any other disease when it comes to addiction or having the urge and trying to stop your current life, and they're trying to change your current lifestyle for a better health outcome. So assess risk factors. You're gonna assess your risk factors, you're gonna assess your behaviors, you're gonna assess your symptoms, you're gonna assess your attitudes, and you're gonna assess your preference. Advise specific, personalized options for the individual. How can the individual decrease? How can the this is how can the smoking decrease, right? How can you work on decreasing your smoking? The functioning, the quality of life, and health improved. What will you have to advise yourself, or the counsel would advise you the reasons why you need to quit smoking, the reasons why smoking is not good, smoking is not healthy, smoking deters your health. So you want to talk about how much better your life would be in regards to and this research has shown that individuals who stop smoking can increase their energy, their stamina, can reduce the risk of getting cancer, can reduce the risk of them dying at an earlier age, things of that nature. Agreeing. So the agrees were collaborative, selective goals based on the patient's interest and motivation to change. So this is the part where the counselor and the individual decides what they want to do and how they want to do it. And the counselor agrees on the steps that they should take, and help in agreement with the way they plan to quit. Assist, provide information, teach skills, problem solve, barriers to reach goals. So this is when the counselor gets into every aspect of trying to help you to manage your smoking habits, to quit, to manage your reaction to be able to stop smoking. So with any type of addiction or any type of health issue that an individual has and needs a behavior change, there are some aspects where the individual can get irritable, can get anxiety, can get aggressive in nature, angry type of things, those type of withdrawal symptoms. So the counselor is there to provide the information, to teach the skills, to manage your emotions and your reaction, and to try to solve those barriers, for you going into relapse. Arrange. They will help with arrange specific plans for follow-up visits, phone calls, mail reminders, things of that nature. If you have worked with a counselor before, there are certain days, so you see a counselor maybe twice a week, once a week, depending on your schedule, and the counselor is there to help you every step of the way, remind you of your appointments, sit with you, and make sure that you're getting the benefits of the counseling process. So personal action plan. You're going to list goals in the behavior terms, list strategies to change behavior, specific follow-up plan in regards to relapse, or even if you're in maintenance where you haven't relapsed, and you want to continue to follow up with your counselors. Share plan with your practice team. So it will be your counselor, maybe your significant other, or anyone that's helping you in this process. Next slide. So we have a video in regards to tobacco cessation. It's a little, it's 15 minutes long, but we're gonna give you some, maybe like a two-minute view of how counseling takes place and what happens and what is said in the counseling in a counseling appointment in regards to tobacco cessation. And Sean, you can start the slide and you can start it like midway for about 2 minutes. You can also find this slide on YouTube, 5 A's of Tobacco Cessation. You want to skip like to the middle? Sorry for the inconvenience of the volume of the video. We will be able to put a link on our YouTube page that directs you to this video. The video is about 15 minutes long. It talks about the process. It's basically a visual interpretation of how the 5 A's are done. How the 5 A's are done in a counseling, tobacco counseling session method. This is motivational interviewing. This is how it works, and this is what individuals would go through in regards to tobacco cessation counseling. So one-on-one, it's very interpersonal, and I hope you can get the link and just Google the 5 A's of tobacco cessation. It's a very informative video. Thank you, and I apologize for the delay. Next slide. So, number 4, how to control your urges to use tobacco, reduce tobacco use, and quit. So we're going to talk about some key points. Create a weekly strategy, goals and progress report. Assess medication use. Identify triggers and reduce your tobacco use. Set a quit date. So these are strategies that an individual will start to identify in the first or second session, both first and second session of tobacco cessation counseling. These are the steps that they should look forward to in regards to putting in the work and basically preparing themselves to quit smoking. Next slide. So the individual will identify triggers and reduce their tobacco use. They're gonna write down when, where, and how much they smoke. When do they smoke? At what times of days do they see themselves smoking? And do they see themselves smoking a lot? Where is someone at when they need to have a cigarette, or where do they smoke often? Where is important because you want to try to avoid smoking in the same places you were smoking at, and when to identify the times that you smoke a lot, the times when you smoke more than normal. And again, how much you smoke, how much you smoke in a day. How much do you smoke in a day? Attempt to quit by a certain date. Soon is better. As you work on your approach, whatever date is best for the individual. They say sooner is better, so you can start the process soon, but it's up to the individual. So you could start a date of a month from now, 2 months from now. But when we say sooner is better, it's to set a quit date within the 6-month time frame. Within a 6-month time frame, or within half of the time that it will allow you to receive tobacco cessation counseling. So if you're going to be seeing a counselor, if you're going to be seeing a counselor or getting help for tobacco cessation counseling within 6 months, 4 months, 3 months, and then use maybe less than more than half the time to set a quit date. You will learn quitting strategies, using a 4-step treatment approach we will talk about in a few minutes. We will talk about how practice is important. Practice is very important. Focus on developing skills that you put you in charge. We're gonna talk about adapting developing skills. What works for you? What makes you feel good to let you know that you're in control and that the cigarettes are not in control of you? And focus on long-term coping for success. We're gonna really get into emotional behavior. The tip of this slide is medications are often helpful. Medications are often helpful. We're going to talk about some medications right in the next coming slides in regards to tobacco cessation. Medications are often helpful. Next slide. Five, identify personal health risk. People develop health complications due to smoking. So we want to assess your health by reviewing your health history. If you tried to quit before, reviewing the types of withdrawal symptoms you may have. We're gonna assess. This is the part where the counselor can assess your nicotine dependence scale, and we're gonna assess your personal health risk and reasons to quit smoking. There is a lot of counselors like to use a machine that can, it's like a breathalyzer for tobacco. So it can assess the amount of tobacco chemical that an individual breathes. So if an individual is a heavy smoker, it can assess the amount of the high toxins that an individual has breathed in with the smoking. So you could basically assess if an individual has smoked and how much they smoked within the last hour or 2 hours. We're gonna get into that a little later and show you a visual of the object that is used to assess smoking. Next slide. So tobacco use is a learned addiction, which means there are different factors involved. Physical dependence. Your body requires nicotine to function normally. It's a habit. It's a habit. Tobacco use is triggered by cues that have been repeatedly linked to smoking. So cues, you have your cues, you have your urge, you have your tobacco use, and you have your consequence. Your cue could be anything from when you finish eating a meal, or you have your morning coffee, or you wake up. The first thing you do, you wake up and you use the bathroom. That's a cue. And then you get your urge. When you wake up, you get your urge, and then you go to use cigarettes while you're in the bathroom, or you smoke a cigarette while you're having coffee. And the consequences are not right there at that moment visual, but in long term you can see the use of it affect you in a way where individuals are unable to breathe properly. They get fatigued easily. They can't walk up flights of stairs, things of that nature. Next slide. So this is a smoking cessation medication prescribing chart. In this chart, when a person stops smoking, you may need to adjust dosages of medication that interact with tobacco smoke. So for instance, we have different types of medications. We have the patch, we have the gum, we have the lozenges, the nasal spray, the inhaler. We have the medication pills, Zyban, Wellbutrin, and Chantix. So there's a suggested regimen that individuals will have to talk with their provider in regards to what works best for them. Sometimes individuals can use sometimes the individual can use 1 or 2 or 3 types of medication methods to help them to quit smoking throughout the process. They have to find out what works best for them. Individuals have to try to maintain the use of their tobacco cessation medication to really utilize what works, to see what precautions they would need to take in regards to the use of the medication. So some precautions are uncontrolled hypertension, skin disorders, specifically with the patch, allergy to adhesive tape with the patch. After a while, there are some side effects after long-term use of certain medications. For instance, stomach ulcers with the gum, lozenge, and nasal spray, and inhaler. As you can see, there's a list of things that individuals need to look out for. Not everyone is the same. Not everyone reacts to medication the same. When they put certain side effects or reactions to certain medications are for individuals who it's a cluster of individuals who have this type of side effect, but it's a percentage, and it's not the whole population in regards to individuals who have used certain medications. Depending on the person and their health condition, that's when the doctor would assess what type of medication is right for individuals. It might not be right for individuals who have had a heart attack or who have had a stroke or dealing with some type of cardiovascular disease, things of that nature. This is a in-depth art into the suggested regimens, the precautions, the contradictions, and potential adverse effects of these medications. And you can find this online. With the pill medication, almost there's a little bit of the same, but not all are the same for the medication in regards to the precautions that individuals need to take when taking the medication. You can talk about you can discuss with yourself in regards to the contradictions of types of pill medication that individuals take. Again, a second reaction, some abdominal disorders, seizures, bulimia, anorexia, things that pop up in the contradictions in regards to Zyban and Wellbutrin, things of that nature. Insomnia is a potential side effect, adverse effect, dry mouth, headache, nausea, constipation, things of that nature. So it's always best to do a deep in-depth dive in regards to the medication that you feel might work best for you. And if you're having any type of reaction to it within the first week, um, try to go try to speak with your doctor in regards to the use of it. It is best to try to use medication for at least 2 weeks to a month to see how your body adjusts to certain medication. But it's best, again, to consult with your doctor in regards to any type of medication. Next slide. Okay, so smoking cessation medication, brief instructions and facts. So, brief instructions, the product, nicotine patch. It is applied to a clean, dry, hairless skin like upper arm, upper back, shoulders, lower back or hip. You have to avoid moisture under patch and wash hands after use. Replace daily. Waking and rotate site daily. So you have to put it on every morning and make sure that you change the site of the patch every day. The gum. So the gum you chew until a peppery taste and slight tingle occurs. Then park it between your cheek and gum. When taste fades, chew again, then park in another area of the mouth. Avoid eating and drinking for 15 minutes before and after use for the nicotine gum. For the nicotine lozenge, allow lozenge to dissolve slowly without chewing or swallowing. And you're gonna avoid eating and drinking for about 15 minutes before and after use. Nicotine nasal spray. You're gonna blow your nose, if not clear, and tilt it back. You're gonna insert the tip as far in the nostril, as comfortable as you can, aiming towards the wall of the nostril. Do not sniff while spraying. Wait 2 to 3 minutes before blowing into the nose. The nicotine inhaler. Inhale using short breaths or puffs to get vapor in the mouth and throat, but not lungs. Store cartridges in a temperature range of 60 to 77 degrees for maximum effectiveness. With Zyban and Wellbutrin, take with food, take 1 pill 3 times a day, then 2 pills starting day 4. Take second pill at least 8 hours after the first, but as early as possible to avoid insomnia. For Shantex, take with food and water, and as directed. Do not make up a missed dose by doubling up the next dose. Do not, with any medication, it's not good to do that. Avoid using NRTs with Chantix. So, audience, thank you for tuning in to this session. We're gonna break this session into 2. We're gonna do a new recording of the rest of the slides, and we'll hope that you join us for the next recording. And we're gonna take off from the second part. Questions you may receive from your questions you may counselor may receive from their patients, and examples of the responses. So we're going to take it up from here on our part 2 of tobacco cessation counseling and resources. I hope you have enjoyed this so far, and please tune in to our second part. Thank you.